We move on to the connective tissue, tumors of the connective tissue origin, which can be classified into benign and malignant. Among the benign, the most common is an oral fibroma, which appears as an epuloid growth on the gingiva, more common in the females, and also it is present on the buccal mucosa and seen as fibrous tissue overgrowth. Epuloid growths can also have a differential diagnosis of a lesion which is called as a peripheral giant cell granuloma, which is a reactive lesion caused by local irritation or trauma. Again, females are more commonly affected than males, located on gingiva or the alveolar ridge. It may be a sessile or a pedunculated nodule. Histopathologically, characteristically will show epithelium. Juxtaepithelially, there will be a clear band of normal connective tissue. And then the tumor mass, which predominantly shows a granuloma background, which is sprinkled with multinucleated giant cells and a lot of hemorrhagic areas. An intraosseous counterpart is the central giant cell granuloma. Its etiology is unknown. It occurs again more commonly in females than the males. Mandible being affected more commonly, it occurs in the angle ramus area more commonly. It is an expansile destructive lesion, and histopathologically it shows a background of granulation tissue with patchy distribution of multinucleated giant cells. So another giant cell lesion, the aneurysmal bone cyst, which is a false cyst. It is a blood-filled lesion which is compared to a blood-soaked sponge. It has an expansile growth. A smallest incision will cause welling up of blood, and histopathologically you will see large blood-filled spaces and in close vicinity multiple multinucleated giant cells. Chondromas and the osteomas and osteoblastomas are the mesenchymal tumors of chondroid and bone. However, these are rare. More common than them are the tori. We have the maxillary and the mandibular tori. Maxillary in the palatal region, mandibular tori in the body of the mandible on the lingual side, which may be unilateral or bilateral. Vascular tumors, moving on to hemangiomas, we have got three types, the capillary, cavernous and mixed. It is commonly present on the buccal mucosa and the tongue. Histopathologically, you will see small and large endothelial lined blood vessels which are engorged. Lymphangiomas are another vascular lesion classified as simple, cavernous, cellular, diffuse and cystic. Histopathology will show large endothelial lined vascular spaces. Fibrosarcomas are malignant tumor of the mesenchymal origin, commonly occurring in the long bones. In the jaws, they occur more in the mandible and the men than the females. Metastasize via blood vessels, and oral lesions have a better prognosis than the long bone lesions. Histopathologically, they are categorized as spindle cell lesions, where the spindle cells are arranged in short fascicles showing a typical herringbone pattern. Condrosarcoma is a malignancy of the hyaline cartilage, which has to be appreciated histopathologically. Males are more commonly affected than females. It occurs in the mandible more than the maxilla, and histopathologically you can identify binucleated cartilage cells. Osteosarcoma is a malignancy of bone occurring in the young adults, more in males than in females. They are more common in the long bones and the extremities than the jaws. In the jaws, they are rapidly growing lesions, radiologically seen as a sunburst appearance, which is diagnostic of osteosarcoma. Histopathologically, we can appreciate tumor osteoid, and in close vicinity, group and multiple anaplastic cells will be seen. Histological variants are the fibroblastic, osteoblastic, chondroblastic, and the hematogenous variant of osteosarcoma. To understand this lesion, we should remember the 5 P's, that is pain, paresthesia, periodontal widening, pathological fracture, and protein, which is the bone morphogenic protein. Moving on to a group of lymphomas, the Hodgkin's, the non-Hodgkin's, the Burkitt's lymphoma. The Hodgkin's and the non-Hodgkin's lymphoma has been compared here on this slide. When we speak of Hodgkin's lymphoma, the cell which pops up in our mind is the Reed-Sternberg cell, which classically shows owl's eye nuclei. Lymphomas may be either diffuse or nodular histopathologically. Tumors of muscle tissue origin are extremely rare. Of smooth muscle, they are called as leiomyoma, rhabdomyoma of the striated muscle tissue, and their malignant counterpart being called as leiomyosarcoma and the rhabdomyosarcoma. The tumors of neural origin, in fact, are more common, the commonest of them being traumatic neuroma. It is not a true tumor, in fact, it is an exuberant attempt at repair, always encountered after a tooth extraction or post-surgical procedure. Histopathologically, you can appreciate discrete bundles of proliferating nerve fibers. A common lesion encountered nowadays is Neurofibroma, which is also called as von Reclinghausen's disease. It can occur in any part of the oral cavity, the peripheral lesions being more commonly in the tongue and the buccal mucosa. There is an intraosseous variant also, which is radiologically appreciated as a destructive lesion, where fusiform enlargement of the mandibular canal can also be appreciated. It is a tumor of Schwann cells, fibroblast, and perineural cells. Histopathologically, you can appreciate the spindle cells showing delicate, thin, wavy nuclei arranged in short fascicles in a haphazard manner. Another lesion is Neurilemmoma, which is a slow-growing, single circumscribed nodular lesion of Schwann cells. It can also occur centrally, producing destruction of bone, pain, and paresthesia. The spindle cells are arranged in two patterns, giving rise to two types of tissue, the Antony type A, where there is a regular regimenting appearance of the spindle cells shoulder to shoulder with verruco body formation, and the Antony type B, where the cells are